Welcome to radiologyinfo.org. In this short video, I'll walk you through your lung cancer screening report and help make the medical language a little easier to understand. A CT lung screen looks for lung cancer before symptoms start when it's easiest to treat and cure. Your report was written for your healthcare provider, so it may have medical terms that are unfamiliar. If something worries or confuses you, just write it down and ask your provider or ask to speak with the radiologist. We're always here to help. Many of these findings are commonly seen in many patients and will cause you no harm. Your report has several key sections: clinical history, technique, comparison, findings, and impression. Clinical history. This section explains why you're getting scanned, or in this case, screened. For lung cancer screening, it usually includes your age, sex, smoking history and pack years, and whether it's your first baseline scan or an annual or follow-up scan. Technique. This tells how the scan was performed. For a CT lung screen, you lie on your back, briefly hold your breath, and a series of X-ray images are taken from your lower neck to your upper abdomen. Comparison. Here we check if you've had prior scans and compare them to see if anything has changed. Findings. This section covers what we, the radiologists, see on your images: what's normal, what's not, and what might need follow-up. Let's go through them together. Pulmonary nodules. These are small spots in your lungs. Most of them are harmless, like freckles or moles on your skin, but we track them over time just to be safe. If there are no nodules, the report may say none or no suspicious nodules. Emphysema. If present, emphysema is graded as minimal or trivial, mild, moderate, or severe. If not, you will see the word none. Coronary artery calcification. This is visible plaque in your heart's blood vessels. Plaque can narrow the arteries and increase the risk of a heart attack. Coronary calcification is graded as mild, moderate, or severe. If you have coronary artery calcification, you may need to make lifestyle changes. Take lipid-lowering medications like statins or both. Pleural effusion and airways. We check for fluid around the lungs and whether the airways are clear. Heart and major vessels. We look for signs of an enlarged heart, fluid around the heart, or abnormalities of major blood vessels like the aorta and pulmonary artery. Lymph nodes. Enlarged lymph nodes, also called lymphadenopathy, may be due to infection, inflammation, or other conditions. Upper abdomen. Since the scan includes the top of your abdomen, we note any visible issues, or simply say it's unremarkable if all looks normal. Bones. We look at the bones for fractures, bone lesions, or age-related changes. If nothing stands out, we say the bones are unremarkable. Impression, the takeaway. This is the radiologist summary. It's what we want your providers to focus on. We often give recommendations for follow-up or additional testing in this section. You'll also see a LungRads score. LungRads is short for Lung Imaging Reporting and Data System. This score helps determine what happens next. A score of 1 or 2, aka negative, means there are no concerning nodules. You'll be asked to come back for another scan in 12 months. A score of 3 or 4, aka positive, means something needs closer follow-up. You may be asked to repeat the scan in 3 or 6 months, most likely, talk to a pulmonologist, or rarely you may need a biopsy. A score of 0, aka incomplete, means more images are needed. For example, if you had a lung infection, you may need to repeat a scan in 1 to 3 months. And finally, if we find something important but it is not related to lung cancer, like an aortic aneurysm, the letter S may be added to your score. S findings are often called incidental findings and may need follow-up. Talk to your doctor about any incidental findings. Reading a radiology report can be intimidating, but remember, it's just one part of your care. Write down any questions, talk to your provider, and visit radiologyinfo.org or lungcheck.org to learn more. Thank you.